As a parent and doctor, I know how tough it is to see your kids sick. By the end of this video, you'll learn how I've treated my own kiddos and what I advise my pediatric patients to do when they get plagued with these nasty winter cold viruses. What's up, healthy people? I'm Dr. MAJD, your YouTube primary care doctor, and my lovely medical assistants.
Hi! Welcome to the MAJD channel.
Let's dive in. Number 1. Avoid over-the-counter cough and cold meds for kids less than age 6. Studies show an increased risk of arrhythmias, misdosing, and hospitalizations in this age group when given these over-the-counter treatments. And they're quite ineffective. Not worth the risk, and most doctors who treat kids will tell you to avoid them despite their availability on the shelf. Number 2. A humidifier. You can use a humidifier in the room for kids over the age of 1. Recall the sensation when you actually enter into a hot shower when your nose is stuffy. The humidifier uses the same principles, but on a smaller scale. Number 3, fever reducers. The exception to the rule for over-the-counter meds for young kids. Just remember that acetaminophen, though, can be taken on an empty stomach, but ibuprofen must be taken with food. Just pay extra attention to the written dosing on the bottles, which depends on the weight of your child in order to avoid accidental overdosing. Number 4, raise the head of the bed. The common cold virus typically causes a lot of fluid buildup in the face. That fluid tends to exit from the nasal passages down to the back of the throat, a term that we call postnasal drip. This can cause a cough that awakens your child in the middle of the night. Therefore, propping them up on a couple of pillows at night may help to combat this and allow them to catch a couple more Z's. Now, most viruses peak between day 3 and 5 and significantly improve somewhere between day 7 and 10. Check out my prior video on what the typical viral course looks like so that you may be aware if something strays out of the norm. I'll place a link down below. Now, if your kiddos are acting normally, even though they're sick, if they're eager to play, if they're consuming food and liquids well, these are more reassuring signs. Now, difficulty breathing or inability to reduce a fever is reason to seek the emergency room. And if it's a breathing issue, that is a 911 call. Now, my lovely medical assistants would like to share their knowledgeable experiences with viruses.
If you have a cold and you're playing with other kids, how do you make sure that they don't get your virus?
You cough in your elbow. So if you cough with no elbow, you'll get a virus instead. Yeah, and then you can't go to school.
And then do you wash your hands a lot too when you're sick?
Yeah, so you don't get virus. You cough in your elbow, you sneeze in your elbow, that's it. Don't leave it in the air, please.
Now, if you found the information useful, let me know by giving it a thumbs up and share it with someone else who may find it useful. And don't forget to hit that red subscribe button down there and that bell next to it so that you don't miss any weekly videos. Well, thanks for tuning in. Stay healthy this winter season.
And I'll catch you next time. Give us some more questions.
Do we want kids to watch us too?
Sure. Yeah, sure.
Do you want kids to write you comments down below?
Sure. If their mom and dad say so. Kids or girls or boys or mom or dad.
Anybody.
Or grandma.
So anyone.
Or puppies. That type in their song like this.